Welcome, everyone. We'll get started today. Thank you for coming to our quarterly one business webinar. So this is all about kind of the things that we're learning from our clients and from the research that's going on in the field of nutrition, healthcare, and employee benefits. And today we're taking all of these different areas and kind of synthesizing what are the top strategies that we're seeing to combine the food as medicine movement, nutrition as an employee benefit, and then also kind of filling that gap with where maybe some holes are in the healthcare provider field. So with that, I will kind of share our agenda for today. So we're going to learn all about like what is food as medicine. I think there's a lot of misconceptions out there with that, and reveal our top three strategies. And they go from really big to tactical, and review some case studies. We have two case studies for you today to see how this could actually play out in real life and what the outcomes were. And we'll end with some Q&A. But of course, we love making all of our webinars very interactive. So use the Q&A function or the chat feature throughout, and I'll be able to pop in and share your questions with Brenda as she's going through the content, so you can get your information real time, live. And I also want to say, I mentioned this is our first quarter's business webinar. We are going to do these every quarter, surprise. And so make sure you kind of keep an eye out for our April one that we'll be hosting. Date is to be set, but it's kind of taking this down another level and looking at one of the strategies is going to be about a culture, creating a positive food culture for an organization. So we're going to get kind of granular of what does that look down, bringing a top down, bottom up approach, because we've been in the field doing this. We've got some great experience from both our personal experiences, but then also what's worked really well for a wide variety of businesses, organizations, and industries. I also want to do a quick plug. We do launch live lunch and learn webinars every month. These are for the end user. So you too, because you can learn, I'm sure, a lot of great information about nutrition and cooking. And they're a great opportunity for an employer or an organization to offer to their employees, their patients, their members, to get a really easy, fun, interactive, informational webinar every month. And we switch them between a nutrition topic and a cooking class topic. And you all, here's the invite, you all are welcome to come to any of these, or if you have clients who might be interested in attending, to kind of check us out, like what is Launch My Health all about? I've heard about them, hopefully, but I don't really know what they do. This is a great way to get a taste of our approach, our brand, and how interactive and approachable all of our content is. So I just want to put a little plug out for that. Today's webinar is recorded. You'll get access to the recording. So if you have to drop off early, no problem. And you can share with your colleagues and friends and beyond. So with that, I want to introduce Brenda Navin. She is our founder and our CEO at Launch My Health, and has a whole career based in food as medicine before it was even, known as a thing. I mean, food as medicine goes back to ancient days, which you'll hear about Hippocrates a little bit for a history lesson. But she has been in this field, boots on the ground, figuring out what is going on in our healthcare system, what is going on at patient bedside, and now how can we bring this food as medicine movement to the masses? And she is going to reveal all of the learnings throughout her career on how you can apply this in a way that's really practical, applicable, approachable, like I said, and in a way that's positive too. I think that's a not really, food and nutrition isn't always seen as a really positive force, and that's our motto. So with that, I'm going to kick it over to Brenda, and be sure to chat in your questions throughout. Thanks, Brenda.
Thank you, Amanda, and a very, very warm welcome to everyone on the other side of the screen today. I hope there are some new faces. Obviously, we can't see your face, but welcome you to this webinar. And as Amanda said, I am so excited to share more about food as medicine. But how I'm going to start today is I want everybody to in your chair, wherever you're comfortable. Maybe you're eating lunch too, whatever it is that you're doing. But just take a moment right now to relax. And I want you to take a deep breath in and a really big exhale and breathe out. And I just want you to sit back and relax over the next, 45 minutes or so that I'm talking. And certainly chime in the chat, but I want this to be a really nice, relaxing lunch and learn for you, a webinar for you to just kind of absorb this information. And I want you to find inspiration and hope for the future, especially as it relates to food as medicine. So with this talk about food as medicine, it really starts with my journey. And I want to start by asking each of you to think about a time that you felt defeated, maybe frustrated, shame or blame, or maybe it's something like personal for your health, or maybe a relationship, maybe your job. And just take a moment to just reflect on that for a minute. And as I go throughout the presentation, this can maybe be something that you can find inspiration in, because this is part of my journey. And I want to share more about that with you. So my journey into food as medicine really started with an upbringing that centered around food and whole fresh foods, which inspired me to really go into the field of nutrition. And as I started my career in nutrition, I was really awakened to the reality that healthcare was sick care. So I was inspired to do what I could in the system to change that. And I was pretty successful on a small scale. I integrated whole person well-being into clinical programs. I started a wellness center with a state-of-the-art teaching kitchen. We were doing acupuncture and Pilates and working with different like cancer care support groups. And we also served our vulnerable and disadvantaged community members with these valuable services. But something was always missing, and I could feel it like deep in my soul. And I just felt this calling that there was something more for me to do. And I was continually kind of frustrated by the stories I was hearing from patients and community members. And then there was like this moment that really kind of sealed my future for me. I received an email from a young physician, and I still remember, just opening this up, and it really hit me. It hit me hard. And the article was, I had written an article about gut health and nutrition, and this physician spared nothing to make me feel stupid, shame, and really incompetent. And she told me how I was spreading misinformation about health. And this same mentality is what I saw in the tears of clients as they felt defeated and hopeless about their health. So for me, instead of complaining about what's wrong in our healthcare system, I decided to take action and start my own company. So actually 3 years ago tomorrow will be my anniversary of leaving healthcare and starting Launch My Health. So I'm really excited, really proud to be in this space. And I hope that I am fulfilling a need that is out there in this food as medicine journey, and bringing this movement the way that I can and the way that I can take action. So as we go back to the beginning, what I asked you, if there was a moment that you felt defeated, again, whether it was in your own health or in a personal situation or maybe at work, just think about today, like what you can do and how you can take action, because today we're talking about food as medicine, but really you can take this same application to anything in your life as well. So let's get into the food as medicine journey. And for me, again, I'm the CEO and the founder of Launch My Health, and I'm going to just share a quick little background on who we are, and then we'll get into really the nuts and bolts of food as medicine. So for me at Launch My Health, starting it, we're bringing food as medicine to the masses. And first and foremost, we had 5 key principles that are really important to our organization. And we are designed for people. And that's what I saw missing in the healthcare system, is that we were designing things for physicians. We're designing things for what we want to see in a health plan and to reduce costs, but nothing was actually designed to meet the person, the end user, where they were at. So that was the utmost importance to me. Next, we made it our mission to ensure that our solutions were not just accessible, but scalable. So we're reaching out into rural communities, big cities, different cultures, and different socioeconomic classes and beyond. Thirdly, we innovate for people. And innovation really is our driving force, and it's a commitment to pushing boundaries and really reimagining what's possible in the realm of health and wellness, because we know what's happening right now is not working. And of course, we hold ourselves to the highest standards of excellence, and we really don't want to be mediocre. We want to be the best. So we're looking at the latest research. We measure our outcomes. And lastly, we really want to be cost effective. And that's how you achieve accessibility and scalability, and that true health really is created in the home. So that's what matters most to our health. It's not what happens in a doctor's office. It's not transactional. So for us at Launch, what we do, we're bringing food as medicine to the masses. We do that 3 ways. We have a digital platform, Netflix style. We have private nutrition coaching. We just launched a new GLP-1 program as well. And then we offer specialty services like private events, licensed content, and then consulting too. On the right-hand side of your screen, you just see some of the programs that we target, especially stigmatized conditions, and you will not notice diagnoses over there because that is not, that's kind of that blame and shame that kind of comes up with the stigmatized conditions. All right, so our agenda, we're going to talk about what food as medicine is, 3 strategies to join this movement, what you can do, and then we'll see what food as medicine in action. So this is one of my favorite slides to talk about, because I think this really hits home for people. If we care about health, it is critical that we care about nutrition. 80% of death and disease, mortality and morbidity, is a result of poor nutrition. That's more than tobacco. That's more than alcohol. That's more than hypertension. So if food is at the foundation of our health, the question is, why don't we have more of a focus on it in our healthcare system and in what we do every day in our health and well-being strategies? So food is central to our health. And if we really want to live a vibrant life, food has to be a part of that. So Amanda mentioned this in her intro, like this goes back to ancient time. And I think everybody has heard of Hippocrates. He's famous for the quote, "Let food be thy medicine and medicine be thy food." And many, many other really, I guess, pivotal statements that he made way back that we know are true today. Things about gut health that we're really talking about. And food as medicine, in a nutshell, really holds the belief that food has the ability to prevent, manage, and in some cases reverse disease. And the concept of food as medicine emphasizes the idea that foods we consume play a critical role not only in nourishing our bodies, but also in preventing, managing, treating health conditions. And that a well-balanced and nutrient-dense diet, so meaning that there's nutrients that our body can actually use, can have a profound impact on overall health. And it's a component of disease prevention and management. And my example of why I started Launch in the beginning, the physician that had sent me that email, to me, that message came across as food doesn't matter. And the spread of misinformation about it. And we know for a fact from research that food does matter, and it's an integral part of everybody's health and well-being journey. So the other thing that food as medicine does is it advocates for a shift away from the reliance solely on pharmaceutical interventions toward a more holistic approach that prioritizes wholesome foods, natural foods rich in essential nutrients, vitamins, minerals, antioxidants. and other, compounds that are naturally occurring in food. And really adherents to this kind of food as medicine philosophy believe in harnessing that healing power of food to support functions like the immune system, reducing inflammation in the body, regulating our metabolism. That's one of our most popular webinars that we give for the end user, is how to regulate your metabolism. And it gets away from that shame and blame about like, oh my gosh, I have a weight issue and it's all my fault. It's like, you might actually have inflammation going on, or you might have some gut stuff happening in your body that you can make some food changes and help regulate your metabolism. Can also help regulate and optimize our different organs and their function, like our liver, and promote overall vitality. So this, of course, emphasizes whole fresh foods. So I'm going to give an example of food as medicine, but what I want you guys to do right now is think about a food that you think has really like positive healing properties. Like, what would you kind of consider almost like that superfood? And if you could put that in the chat, that would be great. And Amanda's going to kind of corral those comments in there. And as people are typing that in, I want to talk about an example of food as medicine, and that is curcumin. So this is information you guys can walk away with today and know a little bit more about food as medicine. So curcumin, Amanda and I always talk about this, say this 5 times really fast. This is really a tongue twister word, but it contains curcuminoids, and it's the active compound in turmeric. Many people have heard of this. I think it's pretty popular across many cultures, and it's been used for its medicinal properties for centuries. It is one of the most powerful anti-inflammatory components that you can take, and it fights free radicals in your body. Now, a lot of people have no idea what a free radical is. And a free radical is something that does damage in your body. I like to say it's the equivalent of rust. So like you have a car rusting, it's like your body rusting. And that could be something like an environmental toxin. It could be excess sugar in your diet. It could be the water that you're consuming. It could be the sun. There's all different types of free radicals, and this fights those. So it's like you've got someone in your camp in your body that's like, duking it out with those free radicals. The other thing that it does is it supports BDNF, that's brain-derived neurotrophic factor. You don't have to remember that. Just remember that it supports a chemical in your body that is like Miracle-Gro. Now, who doesn't want Miracle-Gro in your brain? Especially as we talk about longevity. So this really is, kind of a superfood. Now, when you combine this with piperine, AKA pepper, that's black pepper, what's in black pepper, it will boost the absorption by 2,000%. So if you do take a supplement with this, you will also, almost always find pepper combined with it. And it's fat soluble, so it's best consumed with fat at the meal. So if you're mixing it in with any type of like a meal for dinner, you want to make sure that there's adequate amount of fat in there to maximize absorption. It's often used in cooking or beverages. It's a very earthy kind of flavor. Either I think it's kind of like you love it or hate it kind of a thing. So if you don't love it, you can always take it as a supplement. And note, it will stain your counter. So if you've got some beautiful white kind of counters or something, you want to be very, very careful. So I'm going to pause there. And Amanda, do we have any superfoods that kind of came
Oh,
in?
yes, we do.
Yeah.
Really good ones. We got blueberries, cinnamon, avocado, kale, ginger, avocado, alfalfa.
Yeah, those are all great. And I would agree those are all food as medicine. Cinnamon has been shown to really improve blood sugar control. So incorporating that into your diet. I love the avocado. I always say that's like one of my favorite, really nutritious foods. A lot of people don't realize that it's a fruit. And it's also really rich in fiber. It's so creamy, delicious. You can use it so many different ways. So that's great. And blueberries, antioxidant, so good. That's great. You guys are on the ball. So next up is this sounds very negative, of course, but food really is an equal opportunity killer. And, you know, like any good story, there's a villain and a hero. But in this story, in the context of health and well-being, the food we eat is the villain and the hero. And it's an equal opportunity killer and a savior. It can help us and it can harm us. And it's complex, but yet it's simple. And this is why food is so difficult to manage. And it's a food system. We have to have a food systems approach. And you know, what we eat and the risks affect people across a range of demographics, including age, gender, and economic status, cultural backgrounds. It can be detrimental to everybody. Now, your zip code does matter too, and things can be more challenging for certain populations of people, but a poor diet does not discriminate. And again, I'll go back to that one of the first slides that I had up about that 80% of death and disease is related to the foods that we're eating. And it's not so much about not having access to food. It is about the access to the quality of the food. So I want to distinguish between two things. One is diet quality, or and then actual what we would normally consider nutrition security and food security, and they're two very different things. So an example too of just seeing how vast this is in 2018, 10.8 million people died as a result of a poor diet compared to 8 million from tobacco. The cost to the United States is $1.1 trillion annually, which is the GDP for Australia. That's the country I have on the slide here, and the entire defense budget for the United States. So I'm just going to put a question out there for all of you too, just to kind of think about this food as medicine. What can you do in your organization or for yourself to start using food to propel health? And that's really what this food as medicine movement is about. And it's going to take everybody to start taking action. And not just companies like mine, but we need everybody in the game on this. So what we do know is what we have been doing is not working, and it's really important because literally our lives depend on it, and of course our financial health depends on it too. So the question is, again, you know, do you want to be a part of that change? And I hope because you're signed up for this webinar and you're listening that you are excited about this too and want to learn more. So on to food and nutrition complexities. I mentioned this in my in the previous slide that it's simple yet it's complex, and it is so hard because, you know, if we know what eat matters the most for our longevity and living our best life, why don't we focus on it? Well, it's difficult. And to start our healthcare system, which is designed for sick care and generates revenue based on services provided, access to nutrition, education, dietitians, and resources are very limited and still focus on the very sick. So kind of at the end of the line. And in addition to that, insurance coverage is poor, it's complicated. And additionally, we have systemic issues with food access and affordability of healthy, nutritious foods. And of course, this goes back to your zip code really does matter. And then we go down to that household level, and we have cultural food preferences, individual family food preferences. I don't know if anybody on the other side of the screen is a short order cook in your family, but that is stressful. So that impacts the decisions at the household level. We have, you know, rising inflation. Food cost is at an all-time high. Packages are smaller. If you're buying packages, it's just really difficult for people to find ways to eat healthy. Now it can be done, but people need help with that. So really, where does that leave us? I think this is just really interesting stats for you on the other side of the screen. The average person makes 200 food decisions per day, and 36% of Americans eat fast food daily. It's easy, right? Millennials consume the most fast food. 54% report eating it several times per week. And 46% of Americans have a poor quality diet. And that's what's really missing is what matters. So let's jump into the 3 strategies to bring this food as medicine movement to your organization and what you can do. As Amanda said, I'm going to start kind of high level and work our way down. And then I'll give you some case studies on this too. The first one is building a nourishing culture. And this really is like a mind, body, spirit kind of culture around food. It is so important that if this is something that you're going to go down this path, that you align this food culture with your organizational values. I am going to give an example of this when I get into food as medicine in action, so you can actually see what this means, because I think it probably is a little unclear at this point. And remembering that food as medicine culture, or this nourishing culture, is not transactional. It's not a check the box kind of a thing. This is what gets woven into the fabric of your organization, and you see it no matter where you show up. And it's very inclusive. So it's going to support all of your employees and even into the community, which is the last bullet on here. And it needs to be very strategic. And I think that this may seem like, oh my gosh, how would you even undertake this? And again, I'll show an example, and that if you are interested in this, I am going to go through in detail how to do this at our next webinar. And then embedded in the leadership as well. So this has to be a top-down, bottom-up strategy. So the top has to believe in it. There has to be a strategy around it, and you have to go from the frontline employees to and bring that up and really sandwich it to have success. This can align beautifully with your diversity, equity, and belonging strategies. It needs to be incorporated into your benefits and your policies that you have in your organization. And if you do have a cafeteria, woven into that too. So this really is, again, it's about building a culture, and it's not a check the box kind of a thing. This is definitely for an organization that is probably more on the innovative side, and really has strong leadership that believes in this food as medicine movement. Next up, we have a total population strategy. So now we're coming down another layer. You can start at any of these levels. You don't need to do them in any kind of order. It's really about where do you want to start in taking action. But a total population health strategy for your organization around food as medicine takes an upstream approach. It works on prevention all the way up to disease. And it's using food and nutrition to influence everything around health, mental health, cognition, disease, presenteeism, absenteeism, your recruitment, and your retention. So this is starting, of course, you can see that culture piece in there, but this is really about how do you execute on this total population strategy using food. And there has to be a focus on increasing knowledge, skills, and practical information for the end user on this total population strategy. And key to this is knowing your employee population. What type of employees do you have? Are they a lot of frontline workers? Do you have a lot of truck drivers? Do you have, in general, are you just kind of starting out with this and you don't have a lot of buy-in or desire from your population? Do you have a lot of office employees? Do you have people who are educated? Do you have people who are not educated using computers? Do they have access to email? All kinds of things. Where are they living? So there's a lot that goes into this, but that's how you can develop a strategy around your total population that's actually going to work and that you have outcomes for. I think another key component, again, is thinking about that nutrition security versus food security and what you can do to help support people in that process too. And that's, again, going back to knowing your employee population, but key to food as medicine movement. You want to make it easy for people. And also that there's something for everyone along the spectrum of health. And the next slide that I'm going to show you, Amanda and I use this a lot when we're talking to specific groups, because again, this goes back to healthcare. We tend to focus on the end of the line where there's a lot of health issues and a lot of cost. There are programs, services, a lot of resources that go into that bucket of people. But that rising risk population is really where we can make a lot of impact. And that population of people oftentimes are very activated in their health. They desire to do something about their health. And if we have interventions that can help support that population, we can prevent people getting to that pink population where they're sick and high healthcare utilizers. And in my mind, the most important thing is that they have a higher quality of life and are doing the things that they want, because we want to spend the least amount of time in that sick category in our lifetime as possible. And the other thing that this does, the red dotted line that angles up, is in that really healthy population that are very, very activated in their health. There's ways to help support them and use them as role models, and they're high engagers. They're going to be the first people to engage in this kind of movement, and they can help bring along your other parts of your organization in this too. So we need people, we need interventions all along that continuum, but having that focus on that rising risk population is really going to be helpful in driving outcomes, reducing costs, and really having the best high quality life for your employees as possible. And now we're going to go down another layer, and this gets into the health plan design and benefits for your organization. So this may be the easiest place for you to start, is where you can actually make some tactical changes. And so again, you can start wherever it feels right for your organization. But some things to really think about if you want to bring that food as medicine into your organization is to look at your coverage for registered dietitian visits. Look at your health plan design, and maybe you're starting that process now for 2025, but look at how many visits. Do you even have coverage for dietitian visits? Is there a copay? Is there a deductible? Do they have to have a diagnosis? All kinds of things that make this difficult for people to access a nutrition visit. And how do you let people know? How do you communicate that to your population? So that's like I feel like an easy kind of win that you can do is just looking at the coverage. And that's a great place to start. You can also look at, if it's not coverage, you can do a carve-out plan with a vendor. That's what we do with some of our organizations for RD visits. It's a great way to just provide that access. One of our clients that we have right now, a lot of the people utilizing the dietitian visits are in that rising risk population, and they're really looking at how they can prevent disease, and they want to live a high quality life. And although some of them want to lose weight, that is not the primary reason why they're seeking out help either. So it's really interesting to just see what the demographics look like and why, and understand the who is taking advantage of these kinds of opportunities to improve their nutrition intake and the quality of the food that they're eating. The other thing in the health plan design and your benefits are really to look at practical and useful benefits. So what are the biggest pain points for your employees? And that's where you want to start. So if you need to do a survey, if you have a champion network that you can utilize to get some data points as to where you're going to get the most bang for your buck for your employees, that's a great place to start too. And if I went back to that other slide with the spectrum of people, the sick, the rising risk, and the people who are already doing really well, you want to make sure you have benefits along that spectrum from prevention to disease management, and help people along the path and on that journey. There's also things you consider like stipends for fruits and vegetables. Maybe it's a farmer's market, but there's all kinds of different ways that you can make things easy for people to have a healthier diet in their life. You can also think about things like food delivery and meal planning resources that might be really functional for people to access as a benefit. But overall, I think that as a starting point for people. The first two that I talked about, with the total population and the culture, might be a little overwhelming. And this is a great place to start with just some real tactical interventions and give you some time to kind of think about how you want to incorporate a full-blown strategy in your organization. So let's talk about, with the time that we have left before I open this up for questions, about food as medicine in action. And this was a really exciting project that we worked on with the YMCA, and this they gave us permission to share their story here. And this was really on culture building. And what's unique about the YMCA of the North is that not only was this applicable for their employees, but this was also because they serve members too. So they had to really have this food as medicine strategy around not only how they acted as employees, but how did they deliver their services to their employees, much like probably a healthcare organization. So they have this whole philosophy around whole person well-being, and I have that image on here where it's restore, connect, reflect, move, and nourish. And nourish is kind of that nutrition piece for them. And they needed something to really rally around, and that was positive. So they worked with us to help them do that. And we created this Nourish philosophy, which you guys can see here on the screen. And it aligned with their whole person well-being and across all functions across the YMCA. And what was so successful about this, I think it probably took us about 6 months to create this, is that it was a co-designed process. So they brought in all the key stakeholders. We did design sessions. We came up with this Nourish philosophy. And then we did listening sessions with different groups. And so we wanted to make sure that this fit for everyone. And the impetus for this too, again, was they had this whole person well-being that they were launching. And what they were using in the past was punitive. And it made people, again, how I started this session was with shame, blame, and not feeling good. And what happens when you make people feel like that is they put their hands up and they're like, I don't want any part of this. So this was a really positive rollout. And in fact, they're using this process within the Y to progress in other areas of other elements as they move through this whole person well-being. So this was a great success story. And I think it's a great example of how to, if you can do that strategic piece, how you can build that culture, and very, very well received across the entire organization. So for us at Launch My Health too, this is a food philosophy that we created. Of course, we're a food company, so we need to make sure that we are aligned. This helps us with the companies that we work with too, and we can share this with them and make sure that we're aligned with their values. So you can see what we list here. I think just really important for us to highlight is that we are really focused on the positive benefits that foods provide, and we are diet agnostic. We feel like flexible eating styles are more sustainable than diets that are restrictive, and the best diet is the one that you will follow. And every body is different. So each body is unique. And so that's what we really need to recognize. And then we have the next example that I just wanted to share with you too is food as medicine in the lifestyle realm. I was very fortunate to be able to do the first randomized controlled study in a teaching kitchen. It was a culinary intervention in the prevention of diabetes. So we had a pre-diabetic population. The primary care was the control group. And what we found in this culinary intervention, it's basically our Home Chef Pro that we have, is culinary school for the home chef. The people in this intervention group, we did not talk about diabetes at all. We just taught them how to cook whole, fresh foods, build flavor in their foods. They got to learn how to be in their kitchen and be confident and successful. And what we found was statistically significant reduction in body fat, so improvement in their body comp. Their hemoglobin A1Cs were lower than primary care, and their nutrition intake of healthier foods increased as compared to the control group. So you don't even need to talk about disease in the class. You just need to talk to people about how to cook and build and give them skills. And that lasts an entire lifetime. And it also impacts the entire household. Now, what we didn't measure, but we noticed anecdotally, is improved mental health and social connectedness. So we didn't measure it because we didn't anticipate it. And that's the beauty of research. You get to find out, the surprise things that happen. But really cool study that we did, and just showing that teaching people how to cook can have a powerful, powerful impact. And again, the curriculum just focused on that whole foods process. The last example that I want to share is just our results at Launch My Health. This is our food is medicine, like for a total population. Again, this is about reducing inflammation in the body, and we know that that's the root cause of chronic disease. And in this self-reported survey for Putting Out the Flame, we had over 9,000 participants in this N size, but 93% of the participants who took Putting Out the Flame could identify anti-inflammatory foods. And 48% of the participants enrolled were taking that course to feel their best and prevent disease. So again, we're getting at people who are activated in their health, and they're in that rising risk population, but they want to do something. And 19% already had a chronic condition. And almost all of the participants were able to have an action plan to improve their health. And that's what we want. We want self-efficacy, and we want people motivated and empowered to improve their health. What we saw from a nutrition standpoint is a significant improvement in their diet quality. And again, that's what we're looking at, is diet quality. That's where the research comes in, that standard of excellence that we want to see. And again, we can do this in a positive way that supports and empowers people without blame and shame. The really cool thing on this one too is the alcohol consumption and the red meat really went down. And that was, when we looked at the data, it was really impressive to see the decrease in alcohol consumption too. And then lastly, I just want to share the Food is Medicine, the best diet. So according to US News and World Reports, they do a ranking of all diets. Paleo, does all these diets that are out there. And year after year after year after year, the Mediterranean diet comes out as the best overall diet. That's the same for 2023. There was no change in that. In fact, in 7 categories, it was the top diet. And it's because it is the most researched diet. It has the most data associated with it. It decreases your risk for developing dementia. It improves the gut microbiome, decreases your risk for cardiovascular disease, and improvement in your mental health as well. So it's just one of the best diets, and that's why we use that as a measurement tool. And we see significant improvement in our courses and with clients that we see in the Mediterranean Diet Score as a validated tool to measure. So, and before I open it up for questions, I just want to kind of summarize this Food is Medicine path and journey, and ask you if you are ready to add nutrition to your health and well-being strategy at your organization. And a few words of wisdom just from being in this space for a very long time, working my entire career in this, is to not overthink your strategy and just start. Prioritize what you can do. You can just start taking action today. And I would ask you right now, like, what is one thing you can walk away with today that you can bring back to your organization and do? Or what is one thing that you're going to do for yourself and your family that you can do too? I would also suggest that if you truly are interested in this, to look at if you have an ERG on Food is Medicine. If you don't, you could start one or leverage your champion network to get started in this too. You can start discussing your health plan design for next year if you want to make changes to that. And really take a deep dive and evaluate your nutrition benefits. Do they align with your population needs and your strategy? Are they being used? and what's really going to be beneficial for your organization. And do you have a strategy for all those populations too? And what resources do you need to get started? So just a few, again, words of wisdom as we kind of close this out. And I'm going to turn it over to Amanda and see if we have any questions from the group.
Awesome. Thank you, Brenda. And you can stop sharing your
Oh,
slides too as we
thank
do our
you.
Q&A. We have a few questions. Keep them coming in because we've got a few minutes here to get to them all. But a couple that I really liked. Getting to the tactics. We've heard this
Yeah.
one before, Brenda. My finance team and HR leaders only want us to focus on the sick population. So like people who are diagnosed with diabetes and more. How do I get them to see the reason to support rising risk when they say people won't be employed here long enough to get sick?
We have heard this many times, and I think this goes back to, looking at your organizational values and that's why you need that leadership at the top. But the other thing is with nutrition, you can get an ROI immediately with nutrition, because has anybody ever felt like crap because you had a horrible lunch, or you don't have any energy, or we know that 38 million people in the United States have irritable bowel syndrome, and that can cost up to 10 days of presenteeism a month, where people are, running into the bathroom and having issues with working because of that. So I would challenge that it's not going to have an impact even almost immediately. And you may not necessarily see that in your healthcare claims immediately, but you're going to see that in the quality of how people are feeling on a day-to-day basis. Mm-hmm.
Uh,
And
how do we, oh, yeah.
Oh, I was just going to say, and for organizations that we're working with, we get this kind of question a lot too. We can work with them and help them decide how they need to pitch that to their to the leaders that are making those decisions.
Yeah, one cool thing, there's a tool with using that Mediterranean diet score that Brenda ended with that shows an ROI on claims, taking, what was the improvement in the Mediterranean diet score, which is a survey tool that we use in all of our products. And so you can see, oh, if they increase this much in their score, that the claims are going to decrease this much. So that can be a helpful tool.
The other thing that you can do too is just on the nutrition appointment side, because again, I mentioned this earlier, there's diagnoses, there's so many limitations when you run nutrition visits through a health plan. If you're self-funded, you can consider doing a carve out. That takes your CFO out of the equation. So
from the budget, from having an eye on the budget.
Yeah. So then the HR team can have control over that. So we're always happy to help you learn more about that strategy too.
The carve outs is kind of a secret tool.
Yeah.
If you're self-funded and you haven't heard or played with carve outs before, I would highly recommend looking into it. We love them. They're kind of a fun thing to play with.
It's just a great way to provide access to your employees.
Yes.
Yep.
Another one, how do we do a total population strategy when there's different cultures between locations, especially corporate and manufacturing in this case?
Yeah, I think that's why you really have to figure out, it's kind of like the YMCA when we talked about that example. There's going to be you're going to have like your overall strategy and your culture, and then you're going to have to look at, okay, what do we need to do for this population? What do we need to do for this population? They might be very different. When I came from, well, we have companies that we work with that have these different populations too. And so it's just sitting down and strategizing, like, how do we need to, what does that population need? And how do we need to communicate it to them? And so it's just creating a plan to make sure that you can serve all the people in your organization.
And I think also not making assumptions with what people are interested in. We've been surprised with our benefit, and I think with a lot of well-being benefits,
Mhm.
how many, this is a stereotype, how many men are taking our course at cooking courses they're super interested in. And so that's been, there are ways that you can kind of tap into what people might be interested in and how you approach
And
it.
again, too, I like that, Amanda, you not to make assumptions too, because we do have employers that have truck drivers that are in manufacturing, and we have men that are signing up for private nutrition appointments that are in those roles that traditionally you would think are hard to reach and wouldn't access that.
Can you give some examples? This is about that survey when you said you could do a survey. Can you give some examples of the biggest pain points that might come out in a survey to make sure you're offering those practical, useful benefits?
Yeah, I think this is something, and Amanda chime in here too. Amanda and I worked together in the healthcare system. We were partners back then too, and we led the employee health and well-being. We are great designers of surveys and being able to get information that you need. And we'd be happy to help somebody, help create that design. But the questions are important and how you ask them so that you just don't get the answers you want to see. You want valid information that you can take action on. But we'd be happy to help create those questions for you.
I mean, one example that I remember
Mhm.
is like I've been really working on eating healthier. And then I go and there's just donuts and bagels at every in-person meeting I have. Or all my meetings are back to back. This one didn't, I'm just making this one up. All my meetings, this isn't me, are back to back, and I don't have time to make a salad or even eat a salad because it takes so long to chew. So how do you kind of build in? We have one client who builds in making sure that there are no hour-long meetings. There are 25-minute meetings or 50-minute meetings to kind of help with that transition time and to make sure people take those breaks throughout. But those are some kind of things that might come out. Um,
I'm seeing a lot of
yeah,
questions come
the
across
carve out.
on the
I
carve out.
know it's a secret.
That I think that potentially might be something we could do a webinar on too, so that we can share more details on how to do that. But for those of you who are asking questions on that, it's something that Amanda and I had done again when we were working in healthcare, and it's a great way to have the money funnel through the health plan without it being billed through insurance. So we can share more detail. We don't have time to go through the details in here today, but for those of you who are interested too, we're happy to have a conversation after this about how that can work in your organization, because it's not hard to do.
Yeah, it's a
Mhm.
taking a chunk. It's I don't know. Yeah,
Yeah,
the
yeah,
conversation. And there you're gonna get an email after this with the recording of this, some key, the three top strategies we talked about. And then there's a little link in there too if you wanted to do a brainstorm session with us, and we can 15 minutes talk about this is what a carve out is. Here's some articles type of a thing on that.
yeah. And just one more little thing on the carve out too is that I think the biggest takeaway from the carve out is it just really going to that. We hear this time and time again. I can't get something approved, or my well-being budget gets cut. And by doing this carve out in the health plan, you're secure, that money is secure, and you can offer more benefits to your employees. So it's a really nice way to protect your budget and have control, make the decisions yourself.
And we're a trend. I don't even know if you can call it a trend, but just in the last couple of months on some of my calls with people, I've been surprised at how, like with brokers and then other businesses who are looking or becoming self-funded, so they can offer these carve-out plans. Like it's not just the massive companies who are only the self-funded ones now, but there are 400 person companies, and
Mhm.
2,000 person companies who are finding that actually you can save a lot of money being self-funded. I know there's risk with that, but when you have a really strong culture and you're dedicated to your well-being benefits, you can actually save a ton of money and build a self-funded plan that adds in all these additional features and is cost saving for your company. So
And addresses the 80% of why we have death and disease.
All right, with that, I think we were done with our questions here. So keep an eye out for that email. You'll get the recording. Our next business webinar will be more about applying this culture of food as medicine. And then stay tuned. There's a little thing, a blurb in your follow-up on what our direct employee lunch and learns are like. And you're more than welcome to check one of those out if you wanted to see what is this like when we're not talking to you in a business way, but in a more practical person-to-person way. So keep an eye out for that. And thank you all for joining us today. Thank you, Brenda, for all this incredible information and kind of breaking it down into, understandable chunks of how you can create a bigger strategy.
Thank you, everyone.